as I do it at the beginning of my lecture, I will assign you groups. I have given you the course outline, and you know what is there. So we will still have groups as well because there is still going to be group presentations. And so the very beginning, we get into our groups. Then we can firm ourselves and then forge ahead in the semester. That is why those of you with phone names, those of you with single names, if we create the groups and you join, automatically you don't have a group. Let this be known. Doris Amanfua, Amoafo, do you have anything to tell us? Doris Amoafo, do you have anything to tell us this evening? Discipline yourselves and mute yourselves. These things shouldn't be repeated. And please, this is not the first semester. The second semester, all of us have the same admission. And so I joined late and I was admitted late doesn't hold in the second semester. And so as we create the groups, please, only one person should take the screenshots. Only one person should send that screenshot to the page, please. Just one person should send the screenshot to the page. That one person should share. Don't forward it. When you forward it, we will not get the group name. So please don't forward it, but rather share. When you click on the screenshots that you have taken and you are sharing, a space will appear. And so that space that appears, you can type the group's name there. Please do not forward. When you forward it, I will delete it. Don't forward, share. When you share it, it will appear. A space will appear for you to type the name of your group. I believe all of us understand what I just said. So I'm coming to create the groupings. Then you, as usual, find yourself. Somebody is still calling herself iPhone. Reps, help them. Because you know that those names, I will compile them myself. So if I'm compiling a name myself, definitely iPhone will not be part. If a student compiles, you can just go and beg the student that iPhone is you. This is an official platform, please. Do the needful. Salah, do the needful. These things, I shouldn't even be repeating it. You know the thing. So there are certain basic rules we all need to adhere to. And so I am creating the breakout rooms. How many groups did we have for the research? Reps, please help me out. How many groups do we have for the research? Hello? I can always go back and check. If they are not talking, let me go and check by myself. Do I have the groups here? Group, research. Research, January, midwifery research. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 24 groups. We are currently 400 here on the platform. So if it is 400 divided by 22 groups, it means 400 divided by 22 groups. It means you are going to have 18 members in each group. 18 and then 19. 18 and then 19. So let's do this. Breakout rooms. Are we including co-host? No. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23. Let's do 22 groups. 22. So if it is 22 groups, 22 divided by 3, we have 7 or 8. Okay. Okay, so as we create the rooms, let's rename the group the Ottawa team, Team Ottawa, Team Ottawa, Team Ottawa, Team Jakarta, Team Team Communication, Team Communication, Team Health, Team Health, Team Promotion, Team Epidemiology, Team Prevalence. Then we have Team Incidence. Incidence. Then we have Team Diagnosis. We have Team Diagnosis. We have Team. We have Team Communicable. We have Team Communicable. We have Team Epidemic. We have Team Endemic. We have team C. We have team exercise. And team relaxation. We have team nutrition. We have team nutrition. We have team trust. We have team trust. We have team temperament. We have team temperament. We have team air. We have team air. We have team stress. We have team stress. 17. 21. We have team. We have Jakarta. We have the tower. We have the beach. We have entry. We have team entry, and then the last team is team community. Team community. So let's go back and see team Ottawa, team Jakarta, team communication, team health, team promotion, team epidemiology, let's make it team biomedical, so you have team biomedical, team prevalence, team incidence, team diagnosis, team biomedical. Let's do team psychosocial. Team psychosocial. Let's do team psychosocial. Team epidemic, team endemic, team exercise, team. Let's do team biomedical, psychosocial, bio, 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 team psychosocial, team, team snow. That is John Snow. Team snow. Team relaxation, team nutrition, team trust, team temperament, team air, team stress, and then team entry, and lastly, team communication. All right, so the groupings are ready, the teams are ready. I've seen people as usual. I can't hear it. As for the complaints, there are some people, they were born with complaints. Anything, they will complain. They will first of all not check their devices, but they will complain. This semester, if you complain and complain, we will leave you behind. And you'll be complaining and complaining and complaining. Abigail, something, something, why are you sharing your slide? Eh? They have come back, torn in people's flesh. They've come back again. Some people, they will always cause trouble. They will always cause trouble. When you ask questions, they will never answer. And then they will just be disturbing people. So all rooms have been open. Can you see your rooms? I'm a muting more. Let me unmute you because some people are disturbing me. You can't see the rooms. Okay. Let's do this. Yeah, but yeah, Juma home. Teams now, you Obviously, on meanwhile, people were joining. We didn't grow for a year. I go close rooms. Meanwhile, people have seen their rooms and they were joining. Why did I even ask this question? Because there are people who will always be in the negative. People already joining their groups. One tete put the no there. So people were actually joining their groups. So options. Mm. Mm. So please have opened the rooms again. Look for the pop-up and then join your rooms. Please take a screenshot. It's very important to me. I don't have a phone, so I will not take that screenshot. Take that screenshot.
Will it fit you? What about that one?
We lecture na All right, so let's see. Team promotion got it. Please, if there are two, still do the same thing. So the names will appear. Team Air is here. Team communication. So we have team communication. I've seen two. Team entry, team promotion. I think I've also seen two. We have some people, they don't learn. Whatever you say, they will do the opposite. I don't know why people find it very something to be deviant. If you can't join or you can't find, we can't do anything for you. I've seen people typing, writing, so many things. There's nothing we can do for you. Please, don't disturb anybody. If you can't join, somebody is now coming to ask, how do you join? It means that last semester you never attended my lecture. If at this point, you can come and be asking this question. Sylvia, a whole rep, you don't conform to things. Please, I am deleting whatever you sent. Do the right thing. May them rapper or no leader or no own follow instruction. If your thing is 3 or your thing is 2, make sure that all the names appear. That is what I said. Oh, yeah, rapper, learn the right thing to do. It's leadership by example. Your network took you off ahead of What's your network in it? You people think this semester we have the time to be listening to your temper tantrums like this. It's an app, so nobody can help you. If your network took you off, nobody can help you. The network took you off, so you are off. What can we do? You must what to do. When you say certain things, they will come and misbehave and still do the wrong things because they want attention for themselves. So as people are posting, I've seen a lot of teams know, a lot of teams, like some people, they will not even see whether somebody has posted or not. So you are also posting. Maybe deleting it, you end up not getting a group. More pay attention, mama. I don't know what is wrong with people, but not doing the right thing. Abigail, so do the right thing. They tantantana. Bakofa diabeto say it in Jakarta. What is wrong with my reps this evening? Ede basa basa na diabeto say it in Jakarta. I've taken it away. When I tell you to do something, do the right thing. Okay. I want to believe that all of us have taken the screenshots and we've put them on the platform. I don't have the screenshot, so if you don't do it, it means that you don't have a group. I don't have a screenshot. I'm charging my phone somewhere. And so if nothing pop up from your screen, there's little we can do. These complaints you should have stopped by now. As some of you complaints are what can we do? It's an app. And so if the network took you off for whatever, what can I do? Yeah, I can't do anything. And so we are closing the platform. In the next something minutes, we are closing the platform. All right, so we will close the platform. And we have just 2 weeks. So today is the first week. After today, the following week, if you don't have a group, it means that you will not have any group. This time, I won't take a whole semester to assign people groups. So if you don't have a group, you can start compiling your whatever. You're somewhere, not on my platform. But it will take 2 weeks. After 2 weeks, if you don't have a group, you are on your own. All right. For this exercise, anytime you are on your own, at least go on the Zoom and be doing some of the things yourselves. All right. Thank you all. Those of us who didn't see the pop-up or whatever, better luck next time. But be it known unto you that if you don't have a group, give your name to your rep. If you didn't see any pop-up, give your name to your rep. Like I said, we are just going to use 2 weeks. 2 weeks. So this is week 1. Week 2 is God willing next week. By next week, you should have a group. If you don't have a group, then it means that you are on your own. You are not going to use a whole semester to assign groups to people like last semester because people were joining. And because of that, hey, MENSAH or whatever, you or whatever, we are done. We are done. So you can't see anything. Time I walk around, now you everyone. We are done. Stop disturbing us. I want to teach. Some of you, if we even give you the whole 2 hours to join the group, you will still come up with stories. So don't worry. You've never done anything on your own. You are not ready. Don't ask me anything. When I talk and you will not listen, don't come and chat and write anything. Some of you, ever since you entered the school, you've never been able to do anything. When we are doing presentation, your network will take you off. But when we are teaching, your network will be stable. When we are assigning groups, your network will take you off. But when we are teaching, your network is stable. Change your ways this semester. Change your ways. Nobody is going to entertain complaints. When it is time for you, iPhone, if you come back here again, I'll throw it away. I just put you at the waiting room so you do the needful. So if you come back here with iPhone, I'll remove you from the class. You cannot join today. Young one iPhone as our iPhone. Other people have iPhones, but they've managed to add their names. What sort of life is that? This is a classroom. When we are doing presentation, your network will take you off. But when we are teaching, your network is stable. Change your ways and stop unnecessary complaints. All of them here, they are all new to the Zoom. Everybody is trying one way or the other to learn. You had the whole semester to learn. You didn't learn. You've come back with stories again and problems. Please. Learn. Why? Learn technology. We are in the technological world now. So if you don't learn certain things, we will leave you behind. So learn and stop complaining unnecessarily. Somebody was even on that platform. I can't join. I don't know whether what the person can join is whether joining the Zoom platform or joining the group. Okay, complaints. Every time they will be complaining. I can't join. I can't join. I can't join. I can't join. Learn so many things. All right, so this evening, my mission here is simple. We are here this semester and the mission is to talk about introduction to community health. Introduction to community health. Here to talk about introduction to community health. And this course, honestly, is a 3-in-1 course. We have community entry and diagnosis, we have health promotion, and then we have epidemiology as well. And so students see this course as technical, and therefore they strive to understand the dynamics when it comes to community entry and diagnosis, then the measuring and interpretation of disease frequencies, and then the self-responsibility action in health promotion. And so this course basically exposes you to community health issues, community entry and diagnosis, community mobilization strategies, the components of community health, promotion of health and self-responsibility approach in promoting health. And it also exposes you to measuring and interpretations of disease frequencies and some communicable and non-communicable disease. And so, like you've seen in your course outline, the first unit will be devoted to health and wellness, where we will talk about definition of health, the concept of health, the wellness concept, determinants of health, attitudes of people towards health, and then the models of health. Then the second unit will tell us about the concept of community health, where we will talk briefly about the history of community health, definition of what community health is, the components of community health problems, community approaches to health disparities, and the levels of prevention. Then the third unit will focus on community entry and diagnosis, where we will actually look at definition of community, the subsystems within the community, the definition of community entry and its importance, community diagnosis, and then how to diagnose a community. Then the fourth will usher us into community mobilization, where we look at the definition, the principles, strategies, action. Then we also talk about community engagement, and then discuss a little on team building and group dynamics. Then the fourth unit, we look at epidemiology, where we look at the origin and history of epidemiology. Then We will also look at the definition of epidemiology and the scope, as well as communicable disease epidemiology. We will learn how to manage a communicable disease. Then we'll talk about study designs, then potential errors in epidemiological studies, and we close the curtain on measuring disease frequencies. That's why you will need a calculator. Then the sixth and the last unit, we'll talk about health promotion. Here we'll try to define health promotion, look at the various declarations and charters when it comes to health promotion. Then look at health promotion strategies. Then we also look at health promotion models. Then we also discuss components of health promotion action. Then we also talk a little bit on ethical issues in health promotion, and we draw the curtain on behavior change communication. And so at the end of the semester, I expect you should be able to demonstrate knowledge and understanding of health and wellness, describe the concepts of community health, demonstrate evidence of knowledge of community entry and diagnosis, examine community mobilization and engagement, and then demonstrate knowledge and understanding of epidemiology. And then finally, should be able to critically examine issues surrounding health promotion. What are your expectations in this course? What are your expectations, your fears, your agitations? What are they? What are your expectations? Introduction to community health. I call it Introcom. What are your expectations? What are your expectations? Yes, Rita, you've unmuted yourself. Do you want to talk? You don't have any expectations. So you just came to the course just like that. Eh? When you don't have the expectation, that is where you don't push yourself to learn. And then you go to the exam room and you realize that fala, even preambles that you have been given. You go to the exam room and you realize that even those preambles, you cannot do anything about it. So you don't have any expectations, all right? If we don't have any expectations, then we move. Yes, Mercy, your hand is up.
Hello, sister. Per your presentation, I heard something like community entering as part of the course. So as a midwife who is working within the community, I'm expecting that at the end of the day, I will be able to integrate well with the community members. And then when I am sent into a new environment, I will be able to know how to enter into it and relate well with others in order to promote health.
Somebody is called, thank you, Mercy Ellen Sewa. She will not say anything, but you come and unmute yourself and just disturb the class. This semester, just know, the moment you unmute yourself and disturb the class, it means that you are disrespecting all of us. It's a disrespect. If you unmute yourself and you disturb us for no reason, it's disrespecting all of us. It's a choice that you have made, that you won't listen to the lecture. So you go to your market and then be buying your stuff in the market. Nobody is preventing you, but don't come and disturb us. Yes, Anne Bright.
Yes, good evening, sister. Please, at the end of this
semester, we greeted ourselves long time ago. If you want to ask question or answer anything. Don't greet anybody. The moment you do it, all the rest will be doing it. Don't do it.
Okay.
Let learning take place.
At the end of the course, I expect that I should know what community health is all about and what it entails. Thank you.
Thank you, dear. Yes, any other expectations? Any other expectations? All right, so if there are no expectations, few of us have expectations, the rest of us, we don't have any expectation. All right, so let's move. So the course expectation is that we have 22 groups. So a cohort of 7 or 8 group will diagnose a community and write a community report. A preamble to that effect will be given. Another cohort will detect and manage a communicable disease. A cohort, the preamble to will be given. Then another cohort will also plan health promotion programs. All these 3 are examinable. Ideally, all 22 groups are supposed to diagnose a community and write a report, detect and manage a communicable disease, plan health promotion programs, but we are limited by time. That's why we will be in cohorts of 7 and 8, and every group in the cohort will come and do their own presentation with the preamble that they have been given. Please take note of that. And this is, if you look at the course outline, you realize that it is according to when. Diagnosing a community and writing a report is, we will do that after the week that we will end community entry and diagnosis. The following week will be the presentation for the cohort that will be diagnosing a community and writing a report. Then the week that we will end epidemiology. I am saying this because there are some of you, when we say certain things, you don't hear, you don't look at the course outline. So immediately you see one preamble for community entry and diagnosis, they will be coming to the study. And the preamble for epidemiology, the preamble for communicable disease, managing communicable disease, and the preamble for planning health promotion. I am the lecturer here. I tell you when to do something. You don't come to ask me so unnecessary questions. So when we finish with community entry and diagnosis, the first cohort will also come and do the presentation within 1 week. So if you come this semester, if you come and then you are asked to do your presentation, because you'll be 7 and all the 7 will have some minutes. So we all do this presentation within the 2 hours. If your group is called and you come and do that shakara that you do, please, sister, and so the sister is in Tamale and somebody is in Oda, and the Oda person wants the Tamale person to share the slides. So they do presentation. Hey, I think I'm having challenges with my screen. Hey, can somebody share it for me? Hey. If you come and do all these stories, this semester, there will be no chance for you to come and do a representation. So please get it straight. the groups that when you are assigning a facilitator and 2 assistant facilitators, get people who have good network. If you are a leader, it doesn't mean that at all costs you should be the one to present. Please, this semester, hold your ears wherever you are. Nobody is going to be given a second chance to come and do presentation again. So if you don't fall within that week that you are doing the presentation, everybody in that group scores 0 for presentation marks. As for the content mark, you'll be given. But for the presentation mark, you will lose it. There will not be any come and do it again. Like you say, come and do it in the chat box. Please, we beg you in the name of God. God is a God of principle, a God of order. So order your life. Be principled. Be focused. Don't go and be taking people whose network will take them off to be your facilitator. Please, this semester, let's mean business. Because the semester is already short. And we have a lot of activities. So no second chances this semester. If your group couldn't present, you are done. Because we also want to get time to do tutorials so that we also understand the course. Then when we finish discussing epidemiology or the epidemiology, what happens is that when we finish talking about managing communicable disease epidemiology, we will pause and then they will discuss. They will come and do their presentation, then we continue. Then health promotion too, what happens is that when we start and we talk about how to plan the health promotion activity, when the guideline is also given, and then we pause, then they also come and do that, and then we continue with the lecture. So please, no rep should be disturbed because the people are disturbing me. Tame your people. I call the shots, not you. I tell you when a presentation is supposed to be done and a preamble will be given. Don't come and add pressure to my already pressured life. Thank you all for understanding. And so we come here, and this evening, I want us to have an interactive lecture. Health, you are professionals, and so you know what health is basically. But let's jojo. Aside the World Health Organization definition, Agnes Amayeboa, we are what? Na nipa. Aside the World Health Organization's definition for health, which is the acceptable definition for us all. In your own way, if you are given the opportunity to be an authority when it comes to the definition of health, what will you say health is? What will you say health is in your own way? You have been given the opportunity to tell us what health is. Yes, Mercy.
Sister, I would say health is when an individual is free from sickness. When somebody is not sick or injured, the person is healthy.
Thank you, Mercy. Yes, Habiba too. Yes, Cynthia, your hand is up.
Hello, sister. Please. Health is a state of complete physical, mental, and social well-being, being free from diseases.
Thank you. Yes, Judith.
Sister, please, health and wellness is the holistic way of living.
Thank you. Any other witnesses? Yes, Georgina, your hand is up.
Sister, please, I will say that health is having a sound and peaceful mind and being free from disease or illness.
Thank you. Yes, Veracious.
Sister, please, this is where one is stable emotionally and free from disease or sickness.
Thank you. Yes, and right.
Sister, I would say health is a complete state of wellness. Thank you.
Thank you. Any other witnesses? And so realize that aside the World Health Organization's definition, all of us have some idea when it comes to health. So we say that health is an old word, an old English word. When they say that somebody is healed, somebody is healed, somebody is whole. When I say somebody is hale and healthy, it means that the person is whole, the person is healed. Then coming from the ecological viewpoint, they say that it is the state of equilibrium between humans and the physical, the biological, and social environment that is compatible with full functionality activity. That is the ecologist. Then the epidemiologist will tell you that when they talk of health, they are looking at the situation where a disease should be present or absent. Then, in the preamble to the Constitution of the World Health Organization in 1948, the World Health Organization declared that health is a state of complete physical, the mental and social well-being, and not merely the absence of disease or infirmity. And so for them, when they say you are healthy, it is not just that you don't have any disease condition, but with your social well-being, the social life aspect of the individual should be sound. Mentally, you should be okay. When you are in the lecture room, you shouldn't be thinking about something that happened. And so the word a state of complete, critics believe that the word complete makes the health status using the World Health Organization's definition difficult to attain. And so those of us that are wearing glasses, it means that physically we are not okay if you want to go by the word complete in the World Health Organization's definition for health. Nevertheless, that is what we all use. All right. Give me about 2 minutes. I'm coming. All right, sorry about that. I needed to pick some water and put on my light. Okay, now we've talked about the definition of health. Now we want to move further to discuss about the concept of health itself. So we say that health, per the World Health Organization definition, is a complete state of physical, mental, and social well-being of an individual, not merely the absence of disease or infirmity. So now, what is the concept of health? And then we are saying that the core concept in the society is health. Why are we saying this? We are saying this because in the society have human beings. And so when the human beings or the individuals living in the society is healthy, the society is healthy. And so for every society, the core value or the core concept in every society is for the people to be healthy, is health. Then we are saying that this same concept of health that we are trying to talk about can be modified and qualified as someone, we can say that somebody has good health, somebody has bad health, somebody has reasonable health, and somebody has poor health. That is the concept of health. Then we are also saying that this concept is also based on a number of varieties of factors, which include a person's age, the gender or sex, the current condition, the past condition, or the demands of the various roles in the society. Realize that now you are a student. January comes with pressure. You just finished your first semester. You had about 2 weeks or so rest. You've entered into the second semester. You have about 10 days or so rest, and then you enter into the first semester of the 4th year. You are a mother. You are a midwife. You are somebody's wife. You are a deacon or a deaconess or whatever in a church. You see, these demands of life can also be based on your health. And so sometimes I realize that as you go through all these things, you become so stressed. You become so stressed. You can't sleep. You don't sleep. It's not easy here. Then health is also used to describe a number of entities. We talk of the philosophy of care, the health systems. We can say good health practices. We can say risky health behaviors. We can talk of health behaviors. We can talk of healthcare costs and then insurance, etc. The midwifery pledge, the ethics of the midwifery profession, all these things can be described as a number of entities. And now we say that health can also be better understood if each person is seen as a part of a complex, interconnected biological and social systems. What are we saying? You are a midwife. 2 women comes to the labor room to give birth. When you took their vital signs and everything, they were okay. They all had a normal delivery. However, at the tail end of the labor, one gets into complications and loses the baby or loses the life. But I realize that these people, if you look at their antenatal book, realize that they have been attending antenatal religiously, consistently. They were following everything, yet at the tail end, something happens. And so you can understand health if you see each individual coming in for care as part of a complex but yet interconnected biological and then social systems. And then we also say that the concept of health is also linked to the changing environment to which the individual could react and change rather than becoming a fixed state. So the person comes to the labor room and you are observing the labor. The labor, you're observing the dilation, you're observing the contractions. And then at some point, sometimes you need to, the person is supposed to push at some point. At some point, some of them will have to be given Sinto or something. And so when you do all these things, or when you are looking at the progression of the labor should progress. The person should not be static. That's why at some point you come in and say that there's obstructed labor or something. The labor should progress. At least the contraction should progress to a point that this person can push. And so the person, somebody who gets into labor and come there as a free state, or the labor is not progressing, most of the time you push them to the theater for them to have an emergency cesarean session. And then we also say that health is linked to how providers perceive the recipients of these services and the options that the providers offers. Still in the labor room, people come and they are going through pain. Labor comes with pain. It is not easy. The pain you suffer, and each and every one of us have a way of enduring pain. Some will be insulting, some of us, we are quiet. We are as quiet as a mouse, but the thing is paining us, but we don't want to shout. And you realize that sometimes if you have gone there to visit a midwife and these women are making noise, anti-midwife into me, anti-midwife into me, anti-midwife, and you hear a whole lot of things. You understand it because you know that pain comes in different ways. People handle pain differently. And so sometimes when someone says, hey, now so was or who and this person that even said that I won't give birth again, it will even take 2 years, the person will come back. But that is how people endure pain. But you, as the health provider, you know the point where you can even try and give analgesics sometimes. Or maybe you give diversional therapy or something non-pharmacological, so that at least it helps us. So it is linked to how you provider perceive recipients. You know that definitely, that is how come when I was going to give birth for my first child and I was going conversing, then the midwife said that, why would that? And they said, was not this I want to account. I was in labor pains, but me now, I was just trying to be gentle. And it's because as a result of the fact that because she's a provider and she knows or she believes that if never given birth before, when you are coming, you should come with drama. You should be coming with shouting. And so if you are not coming with shouting, you are not normal. But sometimes you should also know that everybody reacts to pain differently. Then it brings us to the ideas of health. And then we say that the ideas of health provides the basis for people's perception about health and disease and the midwives and the roles that they play in the delivery of care. Any questions at this point? Any questions at this point? Any questions, any contributions at this point? Mm-hmm. All right. So if there are no questions, let's move and discuss or talk about wellness. When we talk of wellness, we are looking at a situation where the individual is in a state progression or progressing towards a higher level of functioning. They are progressing towards a higher level of functioning. I'll hang that one, and then as we move on, we will still come back to wellness. Now, what determines our health? There are so many things that influences our health one way or the other. But this evening, I want us to look at the biological, you look at the physical, and then look at the lifestyle as well as the health systems. The biological determinant, as far as you are a woman, you are susceptible to certain conditions. And when you talk of the biological aspects of determinants of health, we are looking at the aspects in terms of the physical health and mental health. A woman goes into labor, gives birth, and for some reason, she gets postnatal depression and nobody is even recognizing that. I don't know what triggers it, but there are triggers. I have students, one group of students that are looking at factors that contribute to postnatal depression. Very interesting topic. But mental health is one of the things that have been ignored. We have so much ignored mental health. And mental health is causing us big time. And so when you talk of the biological determinants of it, we are looking at the mental aspect as well as the physical aspect of the individual, and in respect to your age, your gender, and other aspects. Then when we talk of the physical environment, which is a determinant of health, we are looking at such a physical environmental conditions such as the food we eat, the drugs we take in, the water quality, the sanitation, etc. And then when you talk about lifestyle, this time the lifestyle is killing us more. It's the habit and the customs that are our lifestyle. Some of us are marking, and I'm teaching. So I'm marking, I'm teaching, I'm supervising projects. I have my own staff that there's even little time to sleep. There's little time to do so many things, but then sometimes there's even little time to cook. All right. So the habits and the customs are the lifestyle that we portray. And these also influence our life, our health as well. And then the health system in the country. The health system in the country also determines our health. Now you have the health insurance, but there are certain diseases that insurance doesn't cover. And therefore, you need to do out-of-pocket payment for all these. And these also determines our health. Ghana has the basic system. We have the 3-tier in terms of the primary health concepts. We have the basic, we have the secondary, and then we have the tertiary. So the tertiary involves the teaching hospitals and the specialist hospitals. The secondary is the regional and the district hospital, and the basic is the health centers, the CHIP compounds, the community pharmacy, etc. Making sure that health is more equitable to the people. And so sometimes the kind of health system in the country also determines our health. And then, since it's the first lecture, I just want us to quickly cover, because this one is just an introductory phase. Attitudes of people towards health. Some people see health as investment, and so these people will always consider good health as investment. Other people see it as a consumable good, where they will also, they know that health is indispensable. And so they will take supplements, they will do everything possible to ensure good health. And then there are a group of people who also believe that health is a right. And so they shift their health responsibility on others, especially the government. The government is supposed to provide this. So if the government doesn't provide good drinking water, I will not purify my water. I will not drink good drinking water. It is the water that the government gives that I will drink. These people shift their health responsibilities on others. And the last group are the group of people that believe that health is a present oriented. And so they believe, they have the belief, and they are always worried about their health when they are ill. And they will do everything to maintain health to the maximum. There are some people, when they wake up in the morning and see one mosquito bite, they will go and even start malaria treatment. Any questions at this point? Any questions at this point? I think the Germans will say alles klar. And so finally, we look at the models of health. There are so many models of health, but this evening I am just restricting you to these 4, but you will come into contact with other ones like the biopsychosocial, the models of the biopsychosocial, the biomedical, and the rest. But this evening, we want to describe Smith's 4 distinctive models of health: the clinical model, the role performance model, the adaptive model, and the eudaimonistic model. Now, taking them one after the other, please excuse me. So we have the clinical, the role performance, adaptive model, and the eudaimonistic model. When you talk of the clinical model, the people that believe in the clinical model are the people who believe in what we call the conventional medicine. They see the absence of signs and symptoms of a disease as healthy. And so these people do not actually involve themselves in preventive medicine. And so they wait till they see signs and symptoms of a condition of which it might be too late. Then we have the people who also believe in what we call the role performance model, their ability, if they are able to function or perform their social roles, it means they are healthy. Like I will be able to teach, I am marking, maybe I'm not feeling well, but I get up to mark, I get up to teach. And so it looks like you are healthy because you are able to go through the social roles, especially mothers. We go through so many things, and sometimes we believe that if we don't do it, nobody will be there to do it. Then we have the one we call the adaptive model. And this one, if you're able to adapt positively to the social and then mental and psychological changes, then it means that you are well. Your failure to adapt to changes means that you are not well. An example is when you get a divorce and you are not able to go through the change, or when your boyfriend dumps you after so many years of helping him and you are not able to adapt. It gives you go about talking. You are not able to adapt to these changes. We say you are not healthy. And then the last one we want to talk about is the eudaimonistic model. And this one is an interrelationship between your physical, your social, and your psychological as well as spiritual aspects of life. If you're able to interrelate all these things, then we say you are healthy. So the other ones are the biomedical model, the holistic model, the social model, the psychological model, biopsychosocial, and ecological model. Any questions at this point? Any questions at this point? I believe that yes, a hand is up, Bridget.
Sister, so according to Smith, if you are able to deal with just one model, if you are able to manage or work around just one model, are you healthy? Or you should be able to work
What
around
is
all the
happening is
four
that
before you become that healthy?
these are schools of thoughts. You get it? And so somebody at some point, the person is not feeling well, but the person is able to go about the normal duties. Then to the person, he or she is healthy. When we go into the other models next week, you realize that the other models are more holistic. When you get to the other models, you realize that you combine, so you can combine 1, 2, 3. 1, 2, 3. So, but the conventional people are people who do not actually focus more on preventive medicine. They will wait. And the adaptive people are, if I'm able to adjust to whatever negative things or positive changes that are going on within my environment, then I'm healthy. So I Claudia idea. I will see you in you mute her and she will mute herself. Meanwhile, she will not ask any question. She will not contribute. Bridget, are you okay?
Yes, sister. Thank you.
You're welcome. All right. If there are no questions, I think my job here is done. And so we call it a day. We'll meet, God willing, next Friday. Enjoy your weekend. Bye-bye.
Bye.
Bye.
Bye, sister.
Bye.
Bye.
Bye.